I was diagnosed in a small primary care facility in Cuernavaca, Morelos, Mexico. I went in for my first baseline mammogram at 41, expected to come out and go into a meeting, and didn't come out ever, never got to that meeting. And I spent the first couple of weeks after my diagnosis upset, searching, angry, denying treatment. I went through the surgeries, but I had refused the chemotherapy. And one Saturday, I went out for a walk in Cuernavaca, and I started to think all of a sudden about a woman my own age, likely also with 2 young children, who didn't have the luxury of thinking, should I or should I not accept the treatment? And I actually imagined a woman in the hospital across the street at the National Cancer Institute at Cancerología, she not being able to choose either because she didn't have enough money to pay for the drugs to get herself to the hospital, or she didn't have anywhere to leave her children because she'd been abandoned by her husband. And my situation was so different. I had support, I had access in that hospital, and I had insurance. In that very same year, the Seguro Popular was adapted to include breast cancer. I can say in Mexico that any woman diagnosed with the same disease I have, breast cancer, will have access to the same treatment that I got.
La ventaja de que todas las mujeres tengan cobertura a su tratamiento del cáncer de mama también ha tenido algunas consecuencias. Las unidades encargadas de la atención no están en todos los rincones del país, están ubicados exclusivamente en aquellos lugares de mayor población o en las capitales de los estados.
Yo vivía en Taxco, tuve que arreglar las cosas de allá, dejar el departamento. Ya era yo viuda porque tengo 10 años de viuda. Mis 2 hermanos se quedaron aquí en México. Entonces me dijeron, te tienes que quedar aquí porque en Taxco no te vamos a poder apoyar.
Yo no tengo quien me acompañe, pero tuve la fortuna, ¿verdad?, de encontrar una persona donde yo iba a comer, que me facilitó el poderme quedar en su casa.
Estoy acá con un sobrino, pues está uno incómodo. Él ya tiene una nuera y me gritaba al darme de comer, y yo ayudo, yo no estoy sentada.
You usually have to come to your care with someone to take care of you. So you're going to, no matter what, pay for 2 bus fares. Having taken those rounds of chemotherapy myself, I can't imagine having had to get on an 8-hour bus ride after having that chemotherapy. What we've been trying to do is identify opportunities to offer care closer to the patient. A lot of the cancer treatment could be offered in secondary level hospitals or in primary clinics with appropriate training of our staff. But we're just getting there.
Pues estamos encontrando que ya las mujeres están sobreviviendo al cáncer de mama, pero se mueren por otras cosas. El problema es que el sistema no está capacitado para atender la sobrevida de estas pacientes.
Yo no podía creer que eso pasara en tan poco tiempo. Era algo tan monstruoso que yo no podía creerlo. El verme a día cómo iba cambiando y creciendo aquel problema tan feo, ¿no? Y de reventar mi seno, de llegar a oler muy mal y yo no saber qué hacer, no saber qué tomar.
Yo siempre he dicho, no tengo nada, sino de cáncer. Y el doctor me dice, tiene cáncer, señor. Y yo me paro, me vuelvo a sentar y le iba a decir que yo no tenía nada.
Para aquellas mujeres que no necesariamente logran sobrevivir, pues requieren de un tipo de atención especializada que son los cuidados paliativos y control de dolor. Ahora estamos batallando en lograr que estas mujeres que no van a sobrevivir pues tengan acceso a una muerte digna.
Our focus on global cancer as a lens from which we can understand the need for health equity and for global equity, that came out of Mexico. understanding the importance of investing in health, the ability to be able to have national insurance programs. You have to be able to say, this can be done. Well, this is what Mexico did for the Harvard Global Equity Initiative. It said, you can't treat cancer in developing countries, you can't afford to include it in your insurance package. Let me tell you what we've done in Mexico, and let me show you what we've done in Mexico. What Harvard and the Harvard Global Equity Initiative done for Mexico is to help to generate the evidence base to continue to push that forward, as you have to face palliative care, ever more expensive drugs, how to be fair about covering one person and not another, all of those challenges that go along with the health system that's growing up.